Pituitary, pertaining to the pituitary gland. Pitute, combining form meaning phlegm, pituitia, pituitary, pituus. Pituitary gland, an endocrine gland suspended beneath the brain in the pituitary fossa of the sphenoid bone, supplying numerous hormones that govern many vital processes. It is divided into an anterior endohypophysis, and a smaller posterior neurohypophysis. The anterior lobe of the gland is composed of polygonal cells related to the production of 7 hormones. The hormones controlled by hypothalamic releasing factors include growth hormone, somatotropin, prolactin, thyroid stimulating hormone, follicle stimulating hormone, luteinizing hormone, adrenocorticotropic hormone, and melanocyte stimulating hormone. The posterior lobe is morphologically an extension of the hypothalamus and the source of the vasopressin, antidiuretic hormone, and oxytocin. Vasopressin inhibits diuresis by promoting nephron water reabsorption and raises blood pressure. Oxytocin stimulates the contraction of smooth muscle, especially in the uterus, also called hypophysis cerebri, and see also adenohypophysis, neurohypophysis. Pituitary myxedema, a type of hypothyroid condition secondary to an anterior pituitary disease. Pituitarianism, a type of dwarfism associated with hypophysial infantilism. See also pituitary dwarf. Hypothalamus, Greek hippo plus thalamus, chamber. Hypothalamus, hypo plus thalamus, chamber. Hypo, below normal. A portion of the diencephalon of the brain, forming the floor and part of the lateral wall of the third ventricle. It activates, controls, and integrates the peripheral autonomic nervous system, endocrine process, and many somatic functions such as body temperature, sleep, and appetite. Compare epithalamus, metathalamus, subthalamus, thalamus, hypothalamic. Adjective. Hypothalamic amenorrhea, cessation of menses caused by disorders that inhibit the hypothalamus from initiating the cycle of neurohormonal interactions of the brain, pituitary, and ovary necessary for ovulation and subsequent menstruation. Examples of such are stress, anxiety, and acute weight loss. See amenorrhea. Hypothalamic hormones, a group of hormones secreted by the hypothalamus, including vasopressin, oxytocin, and the thyroid. End of 82, beginning of 83. Analog computer, a computer that processes information at a physical quantity, such as voltage, amperage, weight, or length, and presents the results of calculations that can be continuously varied and measured. Compare hybrid computer. Analogous, Greek analogous. Proportionate, similar in function but different in origin or structure, such as wings of birds and flies. Analog signal, a continuous electrical signal representing a specific condition such as temperature or electrocardiogram waveforms. Analog to digital converter, a device for converting analog information such as temperature or electrocardiographic waveforms into digital form for processing by a digital computer, also called a deconverter. Analog, see analog, analogy, Greek analogous, similar to a degree in function or form but different in structure or origin. Analogy, Greek analogous, similar to a degree in function or form but different in structure or origin. Anal orifice, Latin orificium, an opening. 1. The external opening of the end of the anal canal. 2. The anus surrounded by the anal sphincter muscle. Anal personality, see anal character. Anal phase, see anal stage. Anal reflex, a superficial neurologic reflex obtained by stroking the skin or mucosa of the region around the anus, which normally results in a contraction of the external anal sphincter. This reflex may be lost in disease or the pyramidal tract above the upper lumbar spine level, S3 to S4. See also superficial reflex. Anal sadism and psychoanalysis, a sadistic form of anal erecticism manifested by such behavior as aggressiveness and selfishness. Compare oral sadism, anal sadism, and psychoanalysis, a sadistic form of anal eroticism manifested by such behavior as aggressiveness and selfishness. Compare oral sadism, anal stage, and psychoanalysis, the pregenital period and psychosexual development occurring between 1 and 3 years of age, when preoccupation with the function of the bowel and the sensations associated with the anus are the predominant source of pleasurable stimulation. It is regarded as an important determinant or ultimate personality type. Adult patterns of behaviors associated with fixation on this stage include extreme neatness, orderliness, cleanliness, perfectionism, and punctuality, or their extreme opposites. Also called anal phase, see anal character, psychosexual development. Anal stenosis, see imperforate anus. Anal verge, Latin anus plus vergere, to bend. The area between the anal canal and the perianal skin. Analysand, a person undergoing psychoanalysis. Analysis, Greek ana plus lying, to loosen. The separation of substances into their constituent parts and the determination of the nature, properties, and composition of compounds. In chemistry, qualitative analysis is the determination of the elements present in a substance. Quantitative analysis is the determination of how much of each element is present in a substance. 2. An informal term of psychoanalysis, analytic, adjective, analyze, verb, analysis of variance, ANOVA, ANOVA, a series of statistical procedures for determining whether the differences among two or more groups of scores are attributable to chance alone. Analyst, a psychoanalyst, a person who analyzes the chemical, physical, or other properties of a substance or product. Analyte, any substance that is measured. The term is usually applied to a component of blood or other body fluid. Analytic, see analysis. Analytical chemistry, a branch of chemistry that deals with identification, qualitative, and measurements, quantitative, of the component of chemical compounds and mixtures of components. Analytic psychology. 1. The system in which phenomena such as sensation and feelings are analyzed and classified by introspective rather than by experimental methods. Compare experimental psychology. 2. Also called Jungian psychology. A system for analyzing the psyche according to the concepts developed by Carl Gustav Jung. It differs from the psychoanalysis of Sigmund Freud in stressing a collective unconscious and a mystic religious factor in the development of the personal unconsciousness, while minimizing the role of sexual influence on early emotions and psychological development. Analyze the analysis. Analyzing a 5-step nursing process, a category of nursing behavior in which the healthcare needs of the client are identified and the goals of care are defined. The nurse interprets data, identifies problems involving the client's family, the significant others, defines goals and establishes priorities, integrates the information and projects the expected outcomes of nursing activities. Although analyzing follows assessing and procedure planning in the 5 steps of the nursing process, in practice, analyzing is integral to effective nursing practices at all steps of the process. See also assessing, evaluating, implementing nursing process planning. Anamnesis, Greek anamneskin, to recall. Remembrance. 1. Remembrance of the past. 2. The accumulated data concerning a medical psychiatric patient and the patient's background, including family, previous environment, experiences, and particularly recollections for use in analyzing his or her condition. Compare catamnesis. Anamnestic. 1. Pertaining to amnesia or memory. 2. Pertaining to the immunologic memory and the immune response to an antigen to which immunocompetent cells have been exposed. ANAPAC, abbreviation for American Nurses Association Political Action Committee. Anaphase, Greek ana plus phenion, to appear. The 3rd or 4th stages of nuclear division in mitosis, and in each of the 2 divisions of meiosis. In mitosis and the 2nd meiotic division in the centromeres divide, and the 2 chromatids, which are arranged along the equatorial plane of the spindle, separate and move to the opposite poles of the cell, forming daughter chromosomes. In the 1st meiotic division, the pairs of the homologous chromosomes separate from each other and move intact to the opposite poles of the spindle. See also cytokinesis, interphase, meiosis, metaphase, mitosis, prophase, telophase, anaphase, anaphia, an inability to perceive tactile stimuli. Anapheresis, in electrophoresis, the movement of anions in a solution or suspension toward the anode. Anaphylactic, Greek ana, up, phylaxis, protection, pertaining to anaphylaxis, anaphylactic hypersensitivity. An immunoglobulin, IgE or IgG dependent, immediate acting humoral systematic hypersensitivity response to an exogenous antigen. Many substances can trigger anaphylaxis in the susceptible person. The most common allergens are drugs, especially antibiotics, such as penicillin, the most common cause of anaphylactic shock, foreign proteins used as therapeutic agents such as insulin, vaccines, allergen extracts, and muscle relaxants, insect venom, especially from bees, wasps, hornets, and fire ants, and certain foods such as shellfish, berries, chocolate, eggs, and nuts. also called type hypersensitivity. Type 1 hypersensitivity compares cell-mediated immune response, cytotoxic hypersensitivity, immune complex hypersensitivity. See also anaphylactic shock, immunoglobulin, anaphylactic reactions, Greek anaphylaxis protection, Latin reagere to act, acute allergic response involving IgE mediated antigen stimulated mast cell activation. Exposure to the antigen may result in dys, dyspnea, dyspnea, airway obstruction, shock, urticaria, and in some cases death. Anaphylactic reactions may be caused by Hymenoptera stings, foods, medications, or exercise. Rapid administration of subcutaneous epinephrine is the treatment of choice for severe reactions. Anaphylactic shock. A severe and sometimes fatal system hypersensitivity reaction to a sensitizing substance such as a drug, vaccine, specific food, serum, allergen extract, insect venom, or chemical. This condition may occur within seconds to minutes from the time of exposure to the sensitizing factor allergen, and is commonly marked by respiratory distress and vascular collapse. The quicker the system-atopic reaction occurs in the individual after exposure, the more severe the associated shock is likely to be. The involved allergen enters the systematic circulation and triggers an incomplete humoral response that allows the allergen to combine the immunoglobulin IgE and cause the release of histamine. Also entering into the reaction are IgG and IgM, which cause the release of complement fractions, further stimulating histamine action. Observations. The first symptoms are intense anxiety, weakness, and a feeling of impending doom. Sweating and shortness of breath may occur. These are often followed quickly by pruritus and urticaria. Other symptoms may include hypotension, shock, arrhythmia, respiratory congestion, laryngeal edema, nausea, and diarrhea. Interventions. If the patient is conscious and normotensive, treatment requires the immediate injection of intramuscular or subcutaneous epinephrine with vigorous massage of the injection site to ensure faster distribution of the drug. If the patient is unconscious, epinephrine is administered intravenously. The airway is maintained and the patient is carefully monitored for signs of laryngeal edema, which may require the insertion of an endotracheal tube or tracheotomy and oxygen therapy. The sign of laryngeal edema includes stridor, hoarseness, and dyspnea. Cardiopulmonary resuscitation may be required for cardiac arrest. Nursing considerations. Nursing care of patients experiencing anaphylactic shock requires appropriate emergency treatment and the close monitoring of the patient for respiratory distress. Hypotension and decreased circulatory volume expanders as plasma saline solution and albumin are often ordered. Patients with a history of allergic reactions are instructed to avoid offending allergens. Some patients must carry emergency anaphylaxis kits. Such kits contain injectable epinephrine, such as the EpiPen autoinjector, anaphylactoid purpura, see Hennex Schonlein purpura, anaphylactoxin, a polypeptide derived from complement, along with other mechanisms. It mediates changes in mast cells, leading to the release of histamine and other immunoreactive or inflammatory reactive substances. Anaphylaxis, Greek ana plus phylaxis, protection. an exaggerated, life-threatening hypersensitivity reaction to a previously encountered antigen. The response, which is mediated by antibodies of the immunoglobulin IgE or IgG class of the immunoglobulins, causes the release of chemical mediators from the mast cell. The reaction may be localized, wheal and flare of generalized itching, hyperemia, edema, and in severe cases, vascular collapse, bronchial spasms, and shock. The severity of symptoms depends on the original sensitizing dose of the antigen, the amount and distribution of the antibodies, and the route of entry and size of the dose of antigen producing anaphylaxis. Insect stings, contrast media containing iodide, aspirin, antitoxins prepared with animal serum, and allergens used in testing and desensitizing patients who are hypersensitive produce anaphylaxis in some individuals. Penicillin injection is the most common cause of anaphylactic shock. Kinds of anaphylaxis are aggregate anaphylaxis, antiserum anaphylaxis, cutaneous anaphylaxis, cytotoxic anaphylaxis, indirect anaphylaxis, and inverse anaphylaxis. Anaphylactic, adjective, anaplasia, Greek ana plus placine, to shape. A change in the structure and orientation of cells characterized by loss of differentiation and reversion to a more primitive form. Anaplasia is characteristic of malignancy. Compare aplasia, anaplastic, adjective. Anaplastic, ana backward, placian, to mold, pertaining to anaplasia. Anaplastic astrocytoma, see glioblastoma multiforme. Anapnea, Greek anapnea, breathe. Respiration or restoration of breathing. Anaprox, trademark for nonsteroidal anti-inflammatory drug. Naproxen sodium. Anarthria, Greek athron, not joint. A loss of control of the muscle of speech resulting in the inability to articulate words. The condition is usually caused by damage to a central or peripheral motor nerve. Anarthria, a loss of control of the muscle of speech resulting in the ability to articulate words. The condition is usually caused by damage to a central or peripheral motor nerve. Anasarca, Greek ana plus sarx, flesh. Severe generalized massive edema. Anasarca often occurs in edema associated with renal disease when fluid is retained for an extended period. See also edema, anasarkos, adjective. Anastomos, Greek anastomian, to provide a mouth, to open a channel or passage between two vessels or cavities that are normally separate. Anastomosis, Greek anastomoin, to provide a mouth. 1. A connection between two vessels. 2. A surgical joining of two ducts, blood vessels, or bowel segments to allow flow from one to the other. A vascular anastomosis may be performed to bypass an aneurysm or a vascular arterial occlusion. With the patients under anesthesia, a section of the saphenous vein or synthetic prosthesis is grafted to the prepared vessel. Post-operative nursing care includes preventing tissue injury and wound infection. An adequate airway is maintained, oxygen is given if necessary, and vital signs are closely monitored. The Systolic blood pressure is kept at about 20 millimeters Hg above normal to maintain blood flow through the graft. Lack of blood flow may allow the graft to close, a major complication that requires exploratory surgery and sometimes amputation. Pulses distal to the anastomosis are evaluated and their locations marked. Capillary filling time and the color and temperature of the skin are checked. Prophylactic antibiotic therapy may be started. Urinary output is monitored. The patient is turned and frequently encouraged to breathe deeply and, if necessary, to cough. Kinds of anastomosis are end-to-end anastomosis, side-to-side anastomosis. See also aneurysm bypass. Anastomosis at elbow joint. A convergence of blood vessels at the elbow joint, consisting of various veins and portions of the brachial and deep brachial arteries and their branches. Anastomotic, pertaining to or resembling an anastomosis. Anastrozole, an aromatase inhibitor. Indications. It is prescribed in the treatment of advanced breast cancer for postmenopausal women whose disease has not responded to treatments with tamoxifen. Contraindications. The drug is usually effective only in patients with estrogen-dependent tumors. Adverse effects. The side effects most often reported include diarrhea, fatigue, nausea, headache, hot flashes, and back pain. Anatomic. Anaplastomnian to cut, pertaining to the structure of the body. Anatomic age. The estimated age of an individual based on the stage of development or deterioration of the body as compared to that of other persons of the same chronologic age. Anatomic crown. The portion of the dentin of a tooth covered by enamel. See also artificial crown, clinical crown, partial crown. Anatomic curve. The curvature of the different segments of the vertebral column and the lateral contour of the back, the cervical and the lumbar curves appear concave. The thoracic and sacral curves appear convex. Anatomic dead space, the dead space, see dead space. Anatomic height of contour, an imaginary line that encircles and designates the greatest convexity of a tooth, also called surveyed height of contour, see also height of contour. Anatomic impotence, see impotence. Anatomic neck of the humerus, Greek ana, up, temnian, to cut, as, heneca, Latin humerus, shoulder, the portion of the humerus where there is a slight constriction adjoining the head. Anatomic pathology. Greek ana, up, temnian, to cut, pathos, disease, logo, science, the study of the effects of disease on the structure of the body. Anatomic position, a conventional position of the body as if standing erect, facing directly toward, feet pointed forward, slightly apart, arms hanging down at the sides, with palms facing forward. This is the standard neutral position of reference used to describe sights or motions of various parts of the body. Anatomic snuffle box, a small cup-like depression on the back of the hand near the wrist formed by the tendons reaching toward the thumb and index finger as the thumb is abducted, the wrist flexed, and the digits extended. Anatomic topography. Greek ana plus temnian, to cut, topos, place, graphian, to write. A system of identification of a body part in terms of the region in which it is located and its nearby structures. Anatomic zero joint position, the beginning point of a joint range of motion. Anatomy. Greek ana plus temnian, to cut. 1. The study, classification, and description of structures and organs of the body. 2. The structure of an organism. See also applied anatomy, comparative anatomy, gross anatomy, microscopic anatomy, surface anatomy, compare physiology. Antripsis, a therapy that involves rubbing or friction with or without simultaneous application of a medicine. Anavar, trademark for an androgen oxandrolone. ANC, abbreviation for absolute neutrophil count. ANC, abbreviation for Army Nurse Corps. CNC, ANSEF, trademark for a semi-synthetic cephalosporin antibiotic, cefazolin sodium. Ancestor, Latin antecessorem, one from whom a person is descended through the mother or the father. The term assumes a direct lineal line of descent, excluding collateral family members of previous generations. Anchorage, Greek agkira, anchor, surgical fixation of a movable body organ. That was the end of page 88.